Hi, everybody out there. This is Yvonne DeVita, and I'm with Dr. Grace and Dr. Larry for another episode of Scratchins and Sniffins Out Loud. And it is now February, and February is Pet Dental Health Month. We have been talking about it every February for the last 3 or 4 years that we've been writing the blog, but we have new information, and now that we've got Dr. Larry and Dr. Grace to go into a little more detail to help us understand pet dental health, I think it's going to be really educational and informative today. I want to turn it over now to Dr. Grace, and she's going to give us some information on pet dental health. Hi, Dr. Grace.
Hi there. I think a lot of times folks sort of forget about dental health in their pets. We all go to a dentist, but there really aren't that many veterinary dentists, so our regular practitioner or regular veterinarian plays that role. It's very important to keep our pets' mouth clean and free of tartar and disease. There's a lot of different ways that we can do that. The first way is to have the veterinarian check your pet's teeth on an annual basis to see if there is a need for a professional cleaning or any special things that we should do at home.
Yeah, it's interesting to me because when I worked at the cat doctor, we did do teeth cleaning. I was surprised at the amount of tartar that there was on some of the cat's teeth. The other thing that I'm surprised about, and I don't know if this is true in the pet world or not, you and Dr. Larry can help me out here. I was talking to a regular people dentist once who said that dental health influences a lot of other parts of the body.
Oh, it absolutely does. First of all, the accumulation of plaque and tartar on the teeth is very common in pets. In fact, about 80% of dogs and cats have some type of accumulation. But if it gets to an excessive amount, it can actually cause an irritation to the gums or periodontal disease and an infection. And then that infection or the bacteria from that can actually get into the bloodstream and affect other parts of the body. One of the most common places is actually the heart that can be affected.
That's what she said, and it was so surprising. So this is really, really important. Do you have any statistics on those issues, or how many people actually bring their pets and get their pets' teeth cleaned at the veterinarian?
The number is growing, but it's very important to ask your veterinarian when you're in the office if your pet needs to have a professional cleaning and what you can do at home as well. Generally, when pets are really young, it tends not to be as much of a problem. But as they get older, then it seems like that tartar builds up more quickly and they need more frequent dental cleanings.
Grace, what are some of the problems associated with periodontal disease?
One obvious one is that they can lose their teeth. If they have enough of an inflammation and infection around that tooth on the gums, they can actually lose teeth. So that's one of the very apparent things. But again, as I mentioned, bacteria from the mouth can actually get into the bloodstream and affect the heart, the kidneys, really any organ. A lot of people just think, well, I need to get my pet's teeth cleaned because his breath smells bad. And it really goes far beyond that. For the health of the animal, it's very important to keep that mouth clean.
And with cats, too. I mean, my daughter actually does her cat's teeth. I didn't ask her why or who taught her that. She has 3 cats. I'm not sure all 3 of them are as cooperative as the one particular cat. She was showing me how she does it on that cat. So you can do it with your cats also.
You know, that brings up another interesting question I had. Maybe Grace has some information on that. You know, the feline odontoclastic resorptive lesion, the foral condition in cats, Grace? I know that that's a very commonly diagnosed, maybe one of the more common problems, dental problems with cats. Do we know what causes that? Is there any relationship between periodontal disease and foral in cats?
If they have periodontal disease, they're much more susceptible to that, but I think there's more than that as a factor.
The last I heard was that we really don't know exactly what the cause of
I think there's a lot of debate and discussion on that. The only thing we know is either it's more common or it's being diagnosed more in cats.
Yeah. Another reason to have an exam on a cat every year to make sure that they get a look at the teeth, because that can be a very painful condition. Cats can lose weight. It can be a serious issue. How often do you recommend that, say they're over the age of 3, that they get like a cleaning and polishing?
I think they need to be checked every year. It's very individual. I have seen 3-year-old pets that need to get their teeth cleaned right then when they're that young. Then I've seen 10-year-old pets that have beautiful teeth. And a lot of it depends upon whether they like to chew on things at home, what type of food they're on, and just individual variations from one pet to the other, just like people. So you can't really set a hard, fast rule. But I will say that most animals will need a cleaning by the time they're, say, 7. Yeah. And then after they have that first one, it usually is required about every year or every other year.
I think we also have to mention one more important thing. Getting your cat or dog's teeth cleaned is very different than getting your own teeth cleaned because we have to put them under anesthesia. Every veterinarian I've known,
yes,
they want to make sure the animal is healthy enough for that to begin with. Pet parents need to know the better care you take now, not only for their overall health, but for their dental health, will come back in the end to less often teeth cleanings at the veterinarians because they have to be put under anesthesia.
And let me add one thing to that. First of all, it is very important to have that blood check first to make sure everything is okay.
Yep.
But I see a lot of owners of older pets that really, really need to have their teeth cleaned because they have a lot of tartar and in a lot of cases infection in their mouth, and they're afraid to put their dog under an anesthetic.
Mm-hmm.
And I always say there's much more danger to your dog to go around with a mouth that's infected and has a lot of tartar than that anesthetic will be. If they have the blood work ahead of time, and
right.
Today's anesthetics for dogs are very, very safe, there really is no concern, and yet there is concern if they have a lot of periodontal disease.
Right, and I think cats too, and I think that in modern veterinary offices, you do monitor that anesthesia much the way they do in human hospitals, or at least we did. We were always checking it. I don't know if they have a dedicated anesthetist or anything, but I do know that they're trained professionals. They're very concerned, and they want to make sure they clean the teeth. The animal wakes up and is healthy and ready to go home, and I appreciate that comment very much because I think Wavy Wibby's teeth need to be done, and I'm going to be taking her in, and it makes me feel better to hear you say that. I think we've covered pretty good here the veterinary issues. Dental care isn't something that you should just ignore, that in your pets, dental health is a very important thing. So that's it for today, and we will get together again soon and have another Scratchings and Sniffins Out Loud with Dr. Larry and Dr. Grace. And before we sign off, I just want to say that I had a really great time meeting both of you at the National American Veterinary Conference. So
yeah, that was fun. It was fun to put a face with a voice.
Yeah, that conference was so fabulous. We could do a whole podcast on that.
Yeah, it was a great conference.
Purina had a great setup, the veterinary diets, the Purina care. It was quite impressive, and we've been writing about it and tweeting about it. And anyway, just was very happy to meet both of you.
That's cool.
So we'll sign off today, and we'll talk again next month.
Okay.
Okay.